I'm Dr. Julie Vose from the University of Nebraska Medical Center, where I'm Chief of Hematology Oncology and lymphoma specialist. So today I'm going to talk about new therapies for mantle cell lymphoma. First one I'm going to mention is Tecartus CAR T cell therapy. This therapy has now been FDA approved for a while in the US and has been found to be very helpful in certain patient populations who have failed their standard induction therapy and failed transplant if they were eligible and/or BTK inhibitor. This therapy has some side effects, of course, as far as cytokine release syndrome, fevers, hypotension, potentially more advanced higher grade fevers or difficulty with neurotoxicity. However, in a large percentage of patients, it does have an excellent response rate in excess of kind of 80 to 90% as far as overall response rate, and complete response rate is also very high, 60 to 70%. Recently, some long-term outcomes were published in the original trial, which appeared that over 50% of patients were staying in remission long-term, whereas they certainly with other standard therapies would not. So it does have some toxicities. However, I think with the right patient population and choosing those that could successfully receive this treatment, it's one that we certainly are using in more patients with relapse refractory mantle cell lymphoma. The other new therapy I'm going to mention is pirtobrutinib, which is a new BTK inhibitor that was recently approved for patients who had failed multiple therapies and typically had failed a standard BTK inhibitor or could not tolerate that. And pirtobrutinib does have a high response rate in those patients, is fairly well tolerated with respect to toxicity. It can cause some cytopenias, can cause some bleeding abnormalities, and risk of atrial fibrillation as other BTK inhibitors. But in general, it's quite well tolerated. And for patients who had failed other therapies, this is certainly something to try for relapse and refractory mantle cell lymphoma. The third therapy I'm going to mention is bispecific antibodies, although they're not approved yet for mantle cell lymphoma. I think down the road, this will certainly be something that will be available for our patients. So bispecific therapies such as epcoritamab or glofitamab have had clinical trials for relapsed refractory mantle cell lymphoma and do have a fairly high response rate. It is an ongoing therapy in many of the trials with some cytokine release syndrome or neurotoxicity at a low rate in some of the trials, and other side effects that may be standard for bispecific antibodies. However, I do feel that this patient population for relapsed refractory mantle cell will likely need multiple therapies over the lifetime of their treatment, and we need to keep all of these in mind, as well as future clinical trials. Thank you very much for your attention.